It's been over 100 days since the end of the federal COVID-19 public health emergency declaration, though that doesn't mean the end of the disease. With new variants popping up, WBKO's Sarah Phipps reports she spoke to health officials to figure out just how severe they are and what you can do to protect yourself.
Dr. William Moss, Chief Medical Officer for MedCenter Health, says variants are normal in the evolution of a disease and become less severe as time goes on.
When there is a variant that comes across and we don't have the immune system ready for it, it will multiply faster. And of course, the variants may be a strand that is just a more virulent, but not any more serious. And this is how most pandemics will go away. We'll have more infectious, less severe diseases. And then as that trend goes on, then it becomes no more monotonous than like a flu cold season.
A COVID variant causing a lot of buzz right now is the EG5 or Eris variant, an offshoot of Omicron. While the variant is a bit more infectious and may cause more gastrointestinal distress than its siblings, Dr. Moss says it's not setting off any alarms for doctors.
It's something we should watch and pay attention to, but I don't think it's something we should freak out over at this point. There's no indications we're going to have to go back and mask anytime soon. There's no indication we need to isolate anyone at this time, except for when you're sick, of course, to try to spread it to others.
Though hearing the variant is more infectious may make you want to run and get your booster now, Dr. Moss says it may be better to wait.
Because we're dealing with a variant now that this one will cover. The other variants from the past are so far in the past that even having the disease or the vaccines do not have as much effectiveness as if you were to kind of get this new vaccine that's coming out again September 3rd week or so.
As far as staying safe, Dr. Moss says the same rules apply for any other time you may get sick or have COVID.
I would say the biggest thing to do is if you have symptoms is to get a test, make sure what you have going on. There are other viruses that are available that are possible to get. And if you have COVID or any other virus, stay home from school until you feel well and then get back to work, get back to school.
Dr. Moss added that there are now treatments for COVID and its variants, and that those at risk should talk with their doctor about possible medications. Reporting in Bowling Green, Sarah Phipps, WBKO News.
Thank you, Sarah, and we'll have links for more information on COVID treatments and variants on our website, WBKO.com.